Welcome to the 10 o'clock news. This special news bulletin has been brought to you by the University of Bradford midwifery students who are investigating the effects of perinatal mental health in respect to teenage mothers. Our first report tonight focuses on the statistics surrounding mental health.
Perinatal mental health is defined as any psychological condition which occurs in pregnancy or in the first year after birth. Postnatal depression affects up to 25% of women in the UK, with many more suffering from associated conditions. If mental health conditions are left untreated, the long-lasting and significant effects this can have on the woman and her family are potentially devastating, additionally potentially affecting the child's emotional, social and cognitive development in the long term. Hodgkinson et al. Identified that teenage parents are at a higher incidence of postnatal mental health due to dealing with the demands of adolescence, which include environmental and psychosocial stressors, in addition to the demands of parenthood, which are often accompanied by economic and social disadvantages. The relationship between mental health problems and teenage pregnancy is complex and unfortunately not elucidated by current research. However, Irvine et al. And Woodward et al. Propose that the correlation between the two is that teenage parents are often from low-income backgrounds, have a history of abuse, chaotic home environments and have limited social support networks. These have been strongly associated with adverse mental health outcomes. Caring for an infant can additionally intensify the psychological stress the mother may already be experiencing. However, it is unclear as to whether the stress of childbearing at a young age leads to mental health issues or whether adverse mental health outcomes are due to predisposing factors which have preceded the pregnancy. It is well publicised that women in the UK who are suffering from mental health problems are unable to access the support they need. It is estimated 193,708 women experience postnatal depression each year, yet despite this there is a lack of specialist services. In 2016, a national strategy, the 5-year forward view for mental health was published, which was the beginning of the implementation of a plan to improve mental health services across the UK by 2021, aiming to bridge the gap of the estimated 85% of localities which either have a service but it is not meeting current NICE guidelines or which have no service at all.
That documentary highlighted the government's strategic plan to improve the mental health services within the UK over the next 5 years, but this comes with additional challenges midwives face. It is the role of the midwife to be professional and abide by the NMC code, providing care to all women without judgment, discrimination, tailoring care to their individual needs. It has been found that 40.6% of midwives in England had difficulty referring to the appropriate healthcare professional, and a staggering 60.9% of midwives and 78.3% of maternity support workers reported that emotional support should be the focus of postnatal care. A third-year student quoted that women were not declaring issues as an appropriate environment had not been created as questions were or are being rushed through. NHS England 2018 stated that to improve outcomes for women and minimise negative impacts on the baby, it is important that there is a more pressing need for prompt access to care when mental health issues occur. However, 64.9% of midwives in England said that they would like to do more or a lot more in being able to provide a standard of care women are pleased with in regards to emotional support. As midwives, it is our professional responsibility to provide holistic, woman-centred, evidence-based care, but this unfortunately, in some cases, women report this is not the care they have received. Instead, here are some of the issues highlighted. The RCM 2014 highlight the significance of this issue by documenting the thoughts and feelings of teenagers in this position. It is reported in 2018 by NHS England that pregnant teenagers are less likely to attend or access maternity care and to attend antenatal education classes than older parents due to feelings that are highlighted on this screen. We will now head over to our political reporter Danica, who is out on location with the Special Perinatal Mental Health team.
Health England has implemented a framework for supporting teenage mothers and young fathers, highlighting that mothers under 20 have higher rates of poor mental health for up to 3 years after giving birth and 3 times more likely to experience postnatal depression. Additionally, identifying that 2 in 3 teenage mothers have relationship breakdowns in pregnancy or within 3 years after birth. Outlining the cost implications of perinatal depression, anxiety and psychosis to society, roughly costs £8.1 billion each year. These alarming figures are seen to be 5 times more than the cost it would simply cost to improve services.
I think Bradford's very lucky, and we're part of the NHS England funding scheme for perinatal mental health. So the first wave of funding meant that the team could be created. Second year of funding has just been secured, so we're looking at getting a team leader and 2 more care coordinators. As a team, we do work with any age of mum. If the mum was open to CAMHS and had a diagnosis of a severe and enduring mental health problem, we'd joint work with CAMHS those pregnancies, which is why they're on our radar. But just because it's the first time pregnancy in a younger mum, there would be no difference in a referral. Currently in Bradford and Airedale, all inpatient midwives are offered annual mandatory training, which is provided by us as a team. At this moment in time, there's lots of training offered to midwives and health visitors about perinatal mental health.
In the studio is Chelsea with the National Ethical Weather Report of the day.
So the weather report today is somewhat distorted and far from sunny. From the east we see a cloud of judgment rising. There is substantial evidence detailing a range of negative outcomes associated with teenage pregnancies, such as Moffat 2002, Teenage Mothers in Contemporary Britain, and policy has often been aimed at preventing teenage pregnancy in Baird 2011. This can evoke a potentially pessimistic approach to supporting those who have already become mothers. They can easily be seen as risk factors themselves, as children of young mothers reportedly have a bleak future ahead, according to Duncan 2007, whose study indicated that there is an increased risk of criminal behaviour, physical and mental illness and accidents. Stigma and discrimination lightning is heading up north this evening. Stigma and discrimination contributes to the already social problem which surrounds teenage mental health, and it is imperative healthcare professionals realise this. Smith Battle 2013 suggests that it prevents the delivery and uptake of effective care, exacerbating the challenges faced by young mothers. Qualitative research by Ellis Sloan 2014, examining young women's paths to teenage motherhood, highlights that young mothers have an awareness of their stigmatising identity, and this affects how they present themselves. A glimmer of sunshine in the south is highlighted by the importance of recognising the many challenges which are faced by young mothers and their children, and it is essential that the benefits of being a young parent are recognised and enhanced through providing appropriate services. For example, young mothers reported feeling stronger after becoming a mother. Having a baby marked positive life changes such as re-engagement with education, training and employment. Young mothers would therefore benefit from services that facilitate self-development and provide access to peer and professional support networks. From Young Mums Together, Promoting Young Mothers' Wellbeing 2013. Unfortunately, this sunshine will not be around for long, as looming in the east again is a shower of isolation. Get those umbrellas at the ready. UK-based research by Whitehead 2001 highlighted that isolation and exclusion were prevalent among pregnant teenagers, with many teenagers identifying that they felt isolated and alone throughout pregnancy. There has been relatively little research undertaken into the ways in which teenage parents stigmatise each other. However, the findings from Yardley 2008 revealed that some young parents condemn the other teenage mothers while simultaneously presenting themselves as exceptions to the teenage mother stereotype. This finding is of particular interest given that peer support approaches have become increasingly used as a method of education and assistance in relation to the problems faced by young people, which somewhat presupposes peer empathy rather than peer animosity.
Breaking news just in.
Mama Academy Wellbeing Wallets are designed with impartial messages to aid and educate women about their pregnancy. It seems women tend to read this information when waiting for antenatal appointments, in addition to helping midwives to have conversations with women around topics which are vital in a healthy pregnancy. Mama Academy Chief Executive Heidi Loughlin is willing to back the proposal of the introduction of mental health awareness on the Mama Wallets, which are distributed to a number of trusts across the UK. This collaboration is in conjunction with the Department of Health. In conjunction with the proposed recommendations highlighted within the 5-year forward for mental health, it is our hope that the implementation of mental health awareness on the Mama Wallets will enable knowledge surrounding mental wellbeing to become second nature to prospective parents, in turn potentially destigmatising the taboo of mental health, especially within the teenage population.
That's all your news for this evening. Good night.